So the first person we'd like to introduce you to tonight is Cameron McDonald. He's our dietitian. He's also an exercise physiologist and got a lot of experience with breast cancer. So introducing Cam tonight. Welcome, thanks for coming along.
It's a pleasure to be here, Rod.
What we'd like to talk about first, I think we'll start with the exercise and the exercise physiology. So somebody's diagnosed with breast cancer, they go through the Western medical process, the surgery, they've got chemotherapy and radiotherapy to look forward to. What are the benefits of exercise physiology or a good exercise program?
Yeah, well, there's a few things that go on with the body when they go through a process, like a breast cancer diagnosis, surgery, and particularly the adjuvant therapies, the radiotherapy and chemo. There's a lot of fatigue, a considerable amount of fatigue just getting daily duties done. Typically, the women who go through that become a lot less active because they're not feeling up for doing their exercise and their daily function. There's also a lot of body composition change. There's a gain of fat mass and a decrease in muscle tissue, which has got quite bad consequences for the risk of heart disease, diabetes and other related conditions. So exercise really looks to get the body back on track. We know that the fitter you are, the less fatigued you are after treatment, and getting any kind of function back into the legs, reducing the inactivity, can just help sustain the muscle tissue and also decrease the amount of fat tissue that you might accumulate, really, which does a lot to ward off a lot of the heart disease and diabetes. It's in the short term after breast cancer.
So there's we're not talking about kind of standard going to the gym PT exercise, are we? We're talking about a really specific set of exercises by qualified exercise physiologists.
Very much so, yeah. It's important that because obviously when you go through a surgery, when you've got radiotherapy, and you've got all sorts of bits chopped and sliced, as what happens with the surgery, there's going to be a significant amount of scarring and decreased range of motion, all which is going to change the way the exercise has got to occur to make sure you can still do it. Now, particularly in the acute time, that short period after the surgery, the physiotherapy and particularly a physiotherapist is very, very important for getting that range of motion back into the shoulder, and that really is a prelude to the exercise physiology work, which is then looking to build on that function and to really get the body fit again. So and that's where Kate really comes in with her work, is doing a lot of that early rehabilitation on the shoulder. Meantime, there can be a lot of walking, even cycling on a bike, things with lower body that aren't going to affect the upper body so much that can be done quite easily. But even still, intensity needs to be monitored, and it's best to be going in with a qualified practitioner behind you, sort of keeping things safe.
It seems that one of the things that happens post-surgery or post that hospital process, there's not a lot of guidance or direction given to patients. So, coming to see someone like you, they've got an opportunity to now learn about their bodies and do some exercise at a primary level. What other issues might come up that would be enhanced by something like sport and exercise?
Definitely, there's a considerable amount of sort of emotional trauma that goes on, and I mean, there's a lot of research now to look at the relationship between exercise, physical fitness, and depression, the risk of depression, and really improving mental state. And I definitely know from the research that I've been doing as sort of a subjective measure that we've been looking at, there's a real clarity of thinking that the women get back. There's often talk of a thing called the chemo brain. And exercise seems to, particularly exercise that's well directed and hits a certain intensity, can really drive a lot of that cloud away, and that's one of the big things that comes out of the exercise, which is a big part of quality of life. Feeling good is probably one of the most important things.
Going on without it, there's a big part that says post the surgery, post the breast cancer, and once you're into remission, there's a big part of feeling good about yourself, and I guess the exercise and weight loss and just managing that, keeping the body strength, keeping the muscle tissue alive would be important.
Yeah, and I think it's also having realistic expectations of your body as well. There's a period probably of 12 months after treatment where function is just lower than it would be even if you are training quite well. And you're looking at sort of anywhere up to 90% of women put on weight after breast cancer. So even weight maintenance can be a really, really good message, because often women are trying to lose weight and sometimes with a little bit of futility in that early stage after treatment, and sometimes just having the knowledge it's realistic to maintain weight for that initial period, let your body recover, and then really charge into a well-directed weight loss later on if it's appropriate. And that's the realistic expectation is the big one.
Now's a great time to bring in our physiotherapist, Kate Boucher. She's got extensive experience in post-surgery rehab. And so coming over to Kate now with the view of what Cameron was talking about with the exercise and other programs that it's really important to take into place. Post-surgery, what is important, Kate?
So post-surgery, initially we would be expecting a fair bit of pain around the breast area and shoulder area, just simply from being cut open, as for any surgery. And initially in hospital, most patients get to see a staff physiotherapist, and that person will generally give you some basic guidelines towards exercise and management of your pain, but it's generally, and 95% of the time, it's just not enough. So people are left quite disillusioned with what they're allowed to do, what movements are restricted, and how to move forward and to get their range of motion back. So because the surgery is in the shoulder region, people get a lot of shoulder stiffness, and often post-surgically you are medically restricted for your range. So the doctor may say, don't elevate your shoulder above 90 degrees or something like that, and that's just to allow the scar to heal and so that you don't open up the scar again. But after that first week or so, and once the scar's healed nicely, then we can move towards doing some range of motion work, so passive and active range, and what we call active assisted, which is the physio helping you to move through that range and giving you some exercises at home where you can help your shoulder joint to move without actually activating the muscles, which can tear that scar apart. Also, post-surgically, for any surgery, we would expect to see some back pain, so upper back pain, lower back pain, just from not being in your own bed, lying there stiff and sore for several days. So, as most people know, some physio and massage can help with that, and that usually comes good quite quickly, but it's just another factor that can limit your range and limit your quality of life in those initial days after you get out of hospital.
There's so many things people don't think about.
Yeah, absolutely. And there's also just basic surgery risks like blood clots and things like that can be managed with just some, as Cam was alluding to, some lower limb exercises and keeping yourself moving in those initial days. But a lot of people sort of forget about that, and there's so much in hospital that goes on that's just related to your cancer and removing the threat of that cancer. And usually once that's gone, you sort of treat it as, oh, you're all better, you can go home now. But the treatment needs to continue and needs to rehabilitate you back to your full function pre-surgically and pre-cancer. So I guess the other big thing that most people would be aware of is lymphedema and the risk of that post-surgically. Because
what exactly is the lymphedema?
So lymphedema happens, it's a dysfunction of the lymph system. Often people have to have lymph nodes removed along with the lump, and even if they're not having them removed, just having them disrupted by the surgery can cause them to malfunction, and you get pooling of lymph, which is the fluid that normally circulates within our body. We have lymph nodes in a lot of our joint areas, so shoulders, groin, behind our knees, and the normal function is that fluid is circulated through your body and then collected by your lymph nodes and filtered by our kidneys and then passed out via urine. But they can dysfunction after surgery, and particularly if you've had them removed, and you can end up with lymphedema, which is a swelling and enlargement of the upper quadrant or your arm and down through to your hand, and can be quite significant. So people can have quite an enlarged arm because of the dysfunction or the lack of function in the lymph system. So to get that moving again, we do something called manual lymphatic drainage, which is a specialised, really gentle form of massage, which stimulates the lymph system to start circulating again and to stimulate the lymph nodes to start functioning again. And there's also some basic, well, to me they're basic, but I guess some people wouldn't know, but things like positioning of the arm and using compressive bandages and things like that to help assist the lymph travelling back up, and also to prevent it from pooling down the hand.
What sort of pain can someone expect with a surgery like this, whether they've had a lumpectomy or a mastectomy or lymph nodes and those sorts of things removed?
Yeah, look, it's I guess these days with so much keyhole and small surgeries, people are left with often quite small scars on the outside, but it's important to remember that even though you're left with a tiny scar on the outside, so particularly for a lumpectomy, people might not have a large scar, the work they do on the inside can still be really extensive, and you're cutting through layers and layers of fascia and skin and muscle, nerve tissue, and this area of the body is really sensitive, and so you can get quite high levels of pain, and as that scar is trying to heal, and again, even if you've got a small mark on the outside, the healing is happening on the inside still. So through lack of range and just that scar having to heal, it can be, the pain can be enough that you just can't move your arm, and you don't want to move it out because it's so painful. I've never experienced it myself, but I have been around quite a number of people who have, and it can be really unpleasant, and you just don't want to.
What sort of time frame are we looking at? Okay.
So generally, I would expect people to present around a week post-surgery or a week post discharge from hospital to a private physio, and that just gives you enough time to settle back in at home, enough time for the scar pain to settle down. And then after that week, you'd present to physio. We'd assess your range and assess your pain levels and your strength deficits. The studies show, most of the studies are done around a 6-week program, the first 3 to 4 weeks being twice a week physio, and that is concentrated on passive range and active assisted range of the shoulder, also some scar management, so we do what's called some deep friction massage around the scar, and this is after it's healed well, and what that does is increase blood flow to the scar and stop adhesions forming underneath the scar, because as the body heals it, collagen and tissue gets laid down in quite a random fashion, which can cause lots of lumpiness around the scar, and it becomes quite painful, and painful then to move your arm. So it's important to use some manual techniques to get the tissues around the scar to normalise and become part of your body again as a whole, instead of being this scar that's quite rejected by the body. So that for that first 3 or 4 weeks we do twice a week physio, and then move on to just once a week physio for the last 2 or 3 weeks of the treatment program, which, as I said, is around 6 weeks. But at that end point, you would be left with progressions of home exercises to continue your strengthening on, and that's when we'd move to something like the exercise phys to get you strong again. Once I've got your range of motion back and quite pain-free range, then we move on to exercise phys to get you strong again.
And once you've been handed over to the exercise physiologist, you've got exercises and program. What sort of time frame would people be looking at for something like that?
Well, it depends what you're trying to achieve. I mean, if you're trying to get back to your pre-diagnosis level of fitness, it depends how high that was. So really I'd be looking at least 8 to 12 weeks where you're aiming for, I mean, ideally it's exercise 5 times a week if you can, and it's just keeping your body moving, and there's no special science behind this. It's just your body needs to move, and moving it most days of the week is very, very important. Specifically though for breast cancer survivors, resistance training is very, very effective. The loss of muscle tissue, particularly, it's often occurring right at that point where, well, sometimes the chemotherapy can cause menopause, but often it's happening around that time or later when there's a lot of muscular deterioration anyway, a lot of muscle function decline, and the resistance training is probably the best thing to really stimulate your body out of that downward spiral and getting your function back up. The cardiovascular fitness is absolutely essential. However, there should be well, in any of the programs that we're looking at, the resistance training is a very, very important factor and component of those programs. And 8 to 12 weeks will give you enough time to really feel some benefits, whether that's sort of working with someone like myself once a week just to check technique, to keep the intensity level up, but it's designed so that such that we educate you to learn how to do the exercise yourself so that you can carry it on and you don't constantly need to be supported by, you know, week in, week out by health professionals. You educate yourself so you can teach yourself. Yeah.
Great. So I guess we've talked about range of motion and movement post-surgery. We've talked about some of the other bits and pieces that you go through. One of the most important words that keeps coming up is pain. So this time I'd like to introduce our sports therapist, Paul Nash. And he's had some very interesting experiences and got some great experience in the management of pain. So over to you, Paul.
Yeah, in this context, I think one of the best anecdotal things to speak about was pain with a patient that Cam and I sort of shared. She came to see him for all the dietary advice and exercise and whatnot, and she was, I believe, 2 years post-surgery, is that right?
Yeah.
And I just happened to have a 5-10 minutes spare, and Cam noticed that through her words she was in a fair bit of pain, all through the front, obviously the breast area, shoulder, back, sort of headaches, having trouble sleeping because movement was very difficult, and you know, she'd been through all the normal processes that she'd been told to go through, and just experience of me said, right, let's have a quick look at the scar. And something that we can elaborate on another time is the use of the scanner device. Has tremendous results when we use it on scars, and all I did for 5 minutes was basically she lifted her breast up and just exposed the scar all the way through here, and I just had it on the specific scar setting that we use for 5 minutes, just worked on this scar. And as we were doing it, she was commenting that, like, my pain is reducing, and I only had her 5-10 minutes, and that's all we did. And she commented there and then, 50% of my pain has just disappeared. Oh, wow, awesome, you know. So she came back and saw me the next week, and I did a proper session purely with the scanner device, tidying up the scar as best as I could, and she'll tell you herself after that day, probably 90-95% of her pain had gone. She was now able to sleep. It wasn't just this big ugly thing on her shoulder anymore, so she could actually have a bit more clarity because the pain wasn't there. I since have seen her, I think, twice more, using a few more manual therapy techniques to get full range, and one of those days was actually today, and she's now swimming in the pool for her fitness, using the exercise program and whatnot, and she's in a much better place. So it's just interesting, you know, there's lots of therapies out there, and through experience you use what you think is going to work, and I just know that with scarring, because I've done so much work with it with the scanner device, that it's probably a really useful thing for people to explore, particularly if they're having that lingering pain, because everybody's case is different. And I heard lump was right at the posterior side of the tissue, and apparently it was quite hard to get at. So we can imagine the things that were cut through surgically, you know, to keep her alive and remove the lump. But as Kate was saying, you know, we've got nerves, we've got blood vessels, we've got the tissues, we've got just energy, we've got communication between cells all being cut, and sometimes that just needs a little bit more of a push, I think, in the right direction in order to heal. So I'd encourage anyone who has pain that's just lingering and not to their satisfaction going away to probably explore that option, because it's quite useful.
Great. I guess one of the things post-surgically, when you're first diagnosed with breast cancer, you've got to follow along with the doctors and the recommendations and the surgical aspects of that. Once chemotherapy and radiotherapy start, life's a little bit different. You've had this surgery, you've gone through this life-changing event. Now it's more about, I guess, making sure that your body heals as well as it can and supporting you through the next phase. This aspect, quality of life while you're being healed, seems to be one of the critical parts that is very important in terms of treating people. So with that, I'd like to come back to Cameron. Cameron is one of these unique people who has a couple of different hats, and is not only is he an exercise physiologist, he's also a dietitian, currently working on a PhD in breast cancer, and just linking both exercise physiology and dietetics, nutrition. So, Cam, can I ask you to just let us know a little bit more about that?
Well, I guess the premise for it is, after treatment, as I was saying, there's quite a shift in body composition, and really, even though those people who experience menopause in and around the time of treatment, they go through what I've coined the term as a menopausal time warp, where really they age physically 10 years in about the year after treatment, and that's to do with the decrease in muscle tissue and the increase in fat tissue and their general metabolism. Typically women, their risk for diseases like heart disease and diabetes really start to ramp up after 55 years of age. A lot of that risk is brought forward that 10 years by the treatments that they undergo and by that early onset of menopause. So it's so that, I guess, is the general idea of what we're looking at, particularly the body composition, because really muscle tissue is, in my eyes, the barometer of the body state. If muscle tissue is declining, often it means you're inactive, not getting the right nutrients, or there's a significant amount of stress going on. If muscle tissue is increasing, unless you're on steroids, often it means that you are active, you are putting the right nutrients in, and you are managing the amount of stress in your body. So if muscle tissue is declining, that's not necessarily a good thing, and after treatment, that's something that's been really shown quite strongly, is this loss of muscle tissue. So with that in mind, exercise has been shown close to 12 to 13 times in various studies, which are big studies. There's a lot of studies in one particular area, to really increase or at least maintain muscle tissue after treatment and to really improve strength and fatigue. So we've looked at exercise and what effect that can have. In addition, omega-3 fatty acids, which is one of your essential fatty acids and one, I guess, otherwise known as fish oil, it's been shown to have a very anti-inflammatory effect, so that's a de-stressing of the body, and particularly now there's a lot of new research in the effect it has on muscle tissue. And what it does to muscle tissue is it firstly preserves the muscle tissue, less breaks down when there's enough omega-3 in your body. Secondly, it also increases the response that muscle tissue has to exercise. So if someone who did a weight and they got 10 units of growth, if they had a good dose of omega-3 in their muscle, they might get 12 units of growth after a specific exercise. That, and it seems to burn away a little bit of fat, particularly the fat around your stomach, which is the stuff that's more risky for heart disease and diabetes. So we've got in our research, we've got 3 groups. One who's taking quite a large dose of omega-3, another group who are doing an exercise program, and then a third group who are taking both the omega-3 and the exercise program. Now, we're specifically looking at what changes in their muscle tissue. Preliminary findings, which are very, very preliminary, are showing that while some women may be losing some weight, their muscle tissue seems to be holding if they've got the omega-3. And there's been some research to show that weight loss typically results in both muscle and fat tissue loss in this population. So if we're preserving muscle tissue while we're losing fat mass, that's a very, very good thing for disease outcomes, particularly when exercise and omega-3 are the drivers. So our research is sort of halfway through its collection, so there's more results to come. But on top of that, I mean, when you look at a lot of the research to do with heart disease risk, diabetes risk, arthritis, and even obesity and stroke, dementia, arthritis, Alzheimer's, omega-3, just having more omega-3 in your diet, it seems to decrease the risk quite strongly. So as a preventative going forward for these diseases, which are really quite looming after breast cancer treatment, this just getting on a supplement like that is going to have a lot more effect than just the muscle tissue. And we really feel that the muscle tissue and those diseases are quite closely linked.
Wow.
Can I just ask, is it true, and I've read this, that your fat in a female body excretes estrogen? I don't know, maybe males as well. So for the risk of the cancer coming back, if you've got a higher fat percentage and it's excreting estrogen and it's an estrogen-fueled cancer, then if you can keep that percentage or fat percentage as low as possible, then you're therefore decreasing your risk of recurrence of the cancer, yeah?
Yeah, it's a good question, Kate. Definitely those people who come into a diagnosis who are overweight or obese have much poorer outcomes than those who come in lean. However, after treatment periods, big losses and big gains aren't necessarily a good thing. In fact, sometimes the safest ground is weight and maintenance.
Yeah.
However, probably the one more important thing, a lot of the medications that they use practically strip the body of estrogen.
Right.
So the fact that the fat tissue is producing estrogen, a lot of the medications they're on effectively reduce that down to a very, very small number. So, and that's one of the reasons why those medications are used so well for estrogen conditions. However, for all of the other metabolic complications that go along with increased fat tissue, you know, it's not just estrogen that drives this process. So having a body that's functioning well through fit muscles, having less of that fat that is placed in your muscle and in your organs, that's the really important stuff to get rid of. And if that's away, then often it puts you on the right track for reducing sort of recurrence and also those other complications as well.
Yeah, but I'd say as well, if they were a larger individual before the surgery, I've noticed that, definitely estrogen levels are higher with the larger body mass as well in men and women.
Yeah.
So, as Cam was saying, if they're in better form before, the bad news, obviously, possibly that would be a picture of the estrogen as well. But good question.
Moving on from those things, there are various other ways that we can deal with a lot of the issues that come up, and in fact work to improve your quality of life throughout chemo and radiotherapy. So with that in mind, I'd like to introduce Nick, our naturopath, who's an expert in a number of the other things that you can do to help. So Nick, what are the main issues that come up from your perspective as a naturopath? What do you see and how can you help?
Yeah, so generally, from what we've been chatting here as well, energetics are a huge side. So making sure that they've got enough nutritional supplementation if needed, if they're not getting it from their diet. So having a look at their metabolic support. So generally looking at things which are going to look after the healthy tissue, because when you've looked at treatment of getting rid of the damaged tissue or the cancerous tissue, the healthy tissue takes a bit of a blow as well. So when you're looking at cancer, from what I've looked at with research and also treatment as well, it tends to be an anaerobic problem. So it tends to be low oxygen with those patients, which affects the healthy tissue. So getting in there and having a look at mitochondrial support is a big side, and that's looking at your magnesium, looking at your B vitamins, looking at your CoQ10 and acetyl-L-carnitine. So there's a specific bunch of these nutrients which can really look after healthy tissue and healthy performance there as well. If they've been looking at chemotherapy, generally it shreds the digestive tract. So it can cause nausea, it can cause a lot of problems there as well. It can cause ulceration of the lining as well. So there's specific nutrients, specific herbs that can actually heal that damage there as well.
What sort of damage are we talking about?
Yeah, mainly for the treatment that I've done is the nausea after chemotherapy. So you feel wretched after you've had the treatment and you can't eat, and generally your whole digestive tract is inflamed. So that's where you can go into things like slippery elm, which is a specific herb which coats the lining of the digestive system, and that gives the body a chance to heal rather than having irritation from food and other elements there as well. Specific amino acids like glutamine is needed to repair the digestive tract as well. So we've got a great bunch of formulations that can actually go in there and really give that relief there. Another big aspect there, which I find very exciting because I'm a research geek, is the methylation side of things. So when they're looking at methylation, they're generally talking about gene expression, and that's switching on generally growth factors in the body. So when you look at cancer nutritionally, they generally tend to look at overgrowth and overproduction of that cancerous tissue or tumour. So it's unchecked, the growth. And that's generally seen as over-methylation, so there's over-activation which is occurring there. And when you're looking at systemic methylation, it tends to be under. So generally you're not functioning as you should, your immune system isn't working as it should, and there's certain nutrients that can look after that as well. So it's a juggling act between the methylation, between the healthy and unhealthy tissue. So generally there's a lot that we can do depending on what the person's presenting with. So as you said before, it's an individual thing. So depending on their history, depending on their genetics, depends on the direction that I'd take nutritionally and herbally there.
Yeah.
Can I ask Nick, with the cocktail of supplements you were talking about before, is it useful for them to load up on that prior to chemotherapy and stuff, or is it only just during? I mean, a lot of people, I suppose, from diagnosis to getting chemo and radio, there might be a span of weeks or months, I don't know.
Yeah.
Is it useful in that time to really load up on it, or is that just overkill?
No, I think especially with supporting that healthy tissue, looking at that mitochondrial support 3 months before, if possible, would be great, because 3 months is my magic figure that I tend to go for, because in 3 months you tend to do a lot of cell turnover in the body. So if you can preload those cells with that good nutrition to begin with, as you were alluding there, that's going to be excellent to help with the recovery from the chemotherapy, recovery from the surgery, as you guys have been talking about as well. And antioxidant and fish oil support is going to be great there as well. From all the reading and I guess use of fish oils that I've done, it takes about 1 month to start getting benefits from using fish oils. So if you just start using it after recovery and after surgery, you're going to have to take that 3 to 4 weeks to really start getting that benefit there. So preloading specific nutrients are going to be useful, but it's not going to, I think, cover all supplements there. So I'm normally a 1 to 3 supplement person. I don't like to fill somebody up with supplements, so definitely those specifics will be useful there.
I think the other reason that people might need some nutritional support is post chemo and radiation. It damages your taste as well. So people's taste is usually quite metallic after chemotherapy, so they just don't want to eat. And even if they don't have the painful digestive tract like you were talking about, they lose their appetite because nothing tastes like it used to taste, and that's usually lifelong. Like they never usually gain that taste back. So people's diet then becomes deficient in certain nutrients because they're not enjoying food, so they tend not to eat as much as they used to, or certainly the range of foods that they used to, because they don't taste the same and they don't taste right to them. So bringing in some supplements to make sure you're getting the nutrients, especially in that initial phase of healing, I think is important as well. Yeah,
very much. Yeah, and zinc may play a part there. And once again, that whole healing of the digestive tract may actually help with the recovery of those taste buds, or those the cells around the mouth there and the tongue.
And from a dietetic perspective as well, just the fact that you've got so much nausea going on, and the taste issues and all that sort of thing, it can be really difficult to get enough food in, because your body's still undergoing an enormous amount of stress. And this is where a lot of the, particularly in other cancers, but breast cancer as well, is where you're going to be losing a lot of that tissue and be doing a lot of damage. And if you don't have even just the bare calories just to support your body through that process, it can be quite difficult. So, and dovetailing in with that nutritional supplementation can be just really knowing what foods to go for, sort of higher protein foods, higher energy foods, just to get your bare minimum of energy into the body. While you're with chemo, you're not going on a health kick. You know, you're wanting to get your body through in as good shape as possible, and providing the right kinds of proteins, kinds of fats, kinds of carbohydrates as well can be very, very important.
With your direction, just out of interest, my direction's always been cutting out the sugars, for the fact that when you're looking at cancer cells, they exclusively use glucose for their energy. So would you comment on that? Would there be a difference with an approach there, or a similarity with approaches?
Definitely from a dietetic perspective. There's no real rules as to what's cut out and what's put in. I can appreciate definitely that the cancer is a glucose eater. However, typical dietetic prescription is just sort of, let's keep their weight up. It's not so relevant for breast cancer because they don't seem to go through the same severity of change as a lot of other cancers.
True.
So it may, you could probably play with those macronutrients, just as long as you're really monitoring weight and not letting it go down too much during chemo. But I really think the important thing, regardless, is quality of those nutrients. So if you're going to get carbohydrates, sure. If you don't have to have simple sugars, I think it'd be great to get them through good whole grains, your legumes, fruits, things like that, to provide those carbohydrates if you're going to get them, rather than just dosing up on lollies. There's a difference there for sure.
I guess there's a risk as well as a feel-good process of people going to those things, so the education around that's going to be critical.
Yeah, that's right.
I guess moving on, we start to look at the idea that 1 in 9 Australian women get breast cancer, usually between that 50 to 70-year-old bracket. But it's important to note that it's got an 88% 5-year survival rate. So most women are going on to lead very healthy, productive lives post the breast cancer. Getting the surgery is only one part of the healing. I guess that's the bit that everybody worries about. But for breast cancer sufferers, very often the radio and the chemotherapy and the ongoing treatment seems to be the hardest bit of all, because that's the bit where the spirit gets knocked. That's the bit where your weight changes are happening, where you don't feel like eating when you're just feeling terrible and you're in pain from the surgery. So with that long road in mind, it seems like we've got some great suggestions on how to cover those things. From my own perspective as an acupuncturist, there's a lot of really great research in the last few years that's been coming out around things like vasomotor issues. Hot flashes during chemotherapy and radiotherapy are well known. People also suffer with really bad night sweats. They tend to get the nausea and the vomiting, those sorts of things as well. So just from a quality of life perspective, there's some great research for acupuncture helping in that environment. There are difficulties around lymphedema and not needling arms that are full of lymph. We're obviously avoiding those things and working within good guidelines. My own perspective really about helping these people is to keep the nausea down, to make sure that you feel a little better. We know that when people have acupuncture, they feel a little bit better about life. They're a little bit brighter, they're a little bit more relaxed, more calm. We can certainly deal with stress levels and just get you back into that parasympathetic healing phase of the body. And as part of that, you enjoy your food more, you enjoy your life. And my own sense about this is that if people are enjoying their life, they're more likely to survive and go on to live a much better, more productive life.
And sleeping better.
That's one of the other issues. Acupuncture can be used superbly for sleep issues. So whether that be a stress-related issue or something else, there's some really good process to help you sleep, just to help people get through that difficult time. So I guess,
I've got a question for you, Rod, actually.
Absolutely.
One of the big issues that I'm finding with a lot of the postmenopausal ladies is it's a condition called arthralgia. It's a joint pain.
Yeah.
Really, really annoying joint pain that can occur in wrists, in knees, in hips, within the ankle joint. So much so that you try and stretch it and things around it just cramp. It's just, and it's often to do with one of the drugs, the aromatase inhibitors, which are given to those who have been through menopause, and that's the drug that seems to decrease the estrogen production from the fat tissue.
Yep.
Now, there's a lot of good research, and I'd love you to elaborate a little bit more perhaps on your mechanism for acupuncture is one of those only modalities that's seen some sort of change in the arthralgias. There hasn't been, they've gone down the arthritis type treatment without much success, but they seem to be getting some really good results from acupuncture. I'd love to hear you comment on that.
Yeah, I guess acupuncture for pain relief has been one of those things that's widely accepted. There are, postmenopausal women are seen in Chinese medicine, and without going too far into TCM theory, the idea of a yin deficiency becomes more prevalent. Yin, as opposed to yang, is more the sustenance, the substance of the body, and as we get older, it reduces. And as part of this, the arthralgias and it's certainly something that's sped up during menopause. They're not producing the yin anymore, would be the way that Chinese medicine would talk about. So there are some really great mechanisms for, I guess, reversing this. There are really good Chinese herbs for this also. But acupuncture is one of those things that, it's particularly good with arthralgias. The use of moxa and the heat therapy also has a very good, lots of good results with that. It seems to be, the parts of the body that are furthest away from the heart would be my way of thinking about it. Whether it's a wrist or an ankle, they're a long way away from, I guess, the pumping of the blood and those sorts of things. And even just to look at it from a Western perspective, the use of very fine needles, painless ones, which you're able to put in a site of injury also allows the mind to then focus on that. So anything that connects the ankle to the brain has got to be a good thing. And our experience in clinic is to have really good results with those things. The mechanisms of acupuncture are still yet unclear, and I can go into TCM theory or use some of the other theories around that, but they're a little complex. From a Western perspective, we're not absolutely certain how it works.
No.
There's something to do with neuroplasticity and something to do with the different needles lighting up different parts of the brain. So I think it's fair to say, you know, bits of gate theory seem to apply, but not absolutely. There are other ideas around why it works, nerve signals. But what we know is it's really good for pain, as are things like Skenar and the things that we mentioned.
Yep.
Oh, sorry. No, where are you going?
I was just going to say, would you also agree a lot of the medications are heating in the body as well? So that can then further damage yin and work through.
And this
there
is
as
one
well.
of the explanations, is that chemotherapy is very heating, dries out the yin of the body and then creates that dryness in the joints. The dryness in the joints is what leads to the pain. So I guess the idea that they're not lubricated well enough. Chinese medicine is often based on observation rather than physiology or internal mechanics or a modern understanding of the body. So we use terms that are about, you can see a joint that's stiff and sore, doesn't want to move, it's hot, it's dry. Those things about getting more fluid down to the joint. One of the big parts of it.
The other question, well, more statement about the experience you had with the pain and working with me with the diet. Probably one of the greatest things that had occurred was, I was able to look at just getting her moving generally and getting her diet back to what resembled somewhat of a healthy intake. Paul was able to take a significant amount of pain away, even in that very short session. But one thing I'd love to comment on as well is just, we had a chance to talk to Nick for 5 minutes as well. She was experiencing a lot of cramps overnight. Her sleep typically was terrible. I believe Nick gave her some therapy, so it was the magnesium.
Magnesium B combination.
And just straight away, she had a lot less cramping, and that wasn't to do with, I don't think, the diet quality, but just that good supplementation, which is really appropriate, and that's where the individualisation of this all comes to bear. It can be very difficult to give generic advice when everyone's got different set of symptoms, and the same pain expresses a very different way with people. So it was a real testament to just being open to using modalities together, and the importance, the short-term benefit of how other modalities can be used. It was very cool, because straight away she got back to walking and came back in a couple of weeks much happier, which is a good thing.
Yeah, that's great.
That's great. So I guess what we're looking at then is post-surgery, post those things. An environment like Go2 Human Performance allows you to work on range of motion, work on the scar tissue and allow that to heal, to reduce the pain, to go on the right diet and make sure that your body is healthy, to have the right exercise program to keep that muscle tissue going, to have the naturopathic supplements that allow your digestive system to heal and take on the correct nutrients, to have the acupuncture to help you through that chemotherapy, to make sure that the nausea is not there, that you're not vomiting, that you're able to absorb, and to generally just keep your well-being up, not have hot flushes, those sorts of things. And it's that team approach that we know really helps people to move forwards. So I guess when you are in the situation that you may be watching this video, know that there is hope and there are people who care and people who are here to help you.